Good morning. My name is Jose Ollague. I'm a dermatologist and residency program director from Hospital Guasmosur in Guayaquil, Ecuador. Today I'll be speaking about setting up a residency training program in Ecuador and our experiences. Let me tell you a little bit more about dermatologic healthcare in Ecuador. We have about 18 million inhabitants concentrated in 5 major states. Our minimum wage salary is $470, and we have 450 practicing dermatologists, which give us an approximate of 2.5 dermatologists per 100,000 inhabitants. 80% of these dermatologists are in private practice only, and the average cost of a dermatologic visit is between $40 and $50. As you can see in this map on the right side, these are the main provinces or states, as it's called in the US, where our most population is centered. Also, training programs declined after 2010. Before this date, we had 4 training programs for the whole country, and they were graduating between 6 and 8 new dermatologists per year. From 2010 to 2024, only 1 training program remained because of political reasons, and they were graduating around 12 new residents per year. After 2024, we were able to open 2 new programs. The second program was our program, and the third one was recently opened, and we're currently graduating around or training 30 residents per year. As you can see on the graph, dermatology is under lower rank of specialists trained through the year in our country. Let's talk about what the project was, what is the current situation, and what are we looking into the future. We designed a residency program combining the needs of Ecuador and my experience as a resident in the United States. We took 4 medical facilities as the main rotations: 1 general hospital, Hospital Guasmosur, where I work at, where we have general dermatology and cutaneous surgery, inpatient dermatology, dermatopathology, Hansen's, and biologics clinics. But we also added a pediatric hospital, a cancer center, and a private dermatologic clinic where they can train also in lasers and cosmetics. We designed this program around 10 faculty, among them dermatologists, surgeons, dermatopathologists, and pediatric dermatologists. And we established that we will do it in a 3-year training program with 6 residents per year. In the past, before we started our program, we faced a situation about where we're going to hold this program. We were part of an outpatient clinic with 3 outpatient rooms and 1 minor procedure room, as you can see in these pictures, before we could start the residency. With that, we knew that there was an area supposed to become a burn unit that was never open and actually has been working as a hardware store for the hospital. It has been dismantled, and we took the challenge. We believe that we can renovate this area, fix it up, and turn it into an actual department of dermatology. So here it is, our current department in dermatology. We moved from a clinic and built our own department. We, as you can see, we have to put tiles, we have to fix the bathrooms, lining, air conditioning, and now we have the same 3 outpatient rooms. This is an example of one on the video that you're looking at. We also have a minor procedure room. We move it here where we do small surgeries, biopsies, and we get a donation of an IPL that we are using also for cases, for example, pseudofolliculitis barbae. We got a donation for a phototherapy cabin, a full body cabin, and also hand and feet unit. As you can see in this picture, we have our own phototherapy unit. It's serving 70 patients between psoriasis and vitiligo mainly. We have our own nurse station with our nurse. We were able to get this small area for residents to study and prepare their lectures and do their microscope readings for skin scraping, KOHs, scabies preps. And we have a small auditorium where we do our lectures and our grand rounds. So we were able to grow significantly from our previous scenario. These are pictures of our current residents, some of our faculty, and some of the older dermatologists from their area who were invited to the opening of our service. Among our highlights, we've started also with academic production. Our residents have been able to present at local and national meetings, and they have been accepted to present in 2 international meetings also. They're working on case reports, case series, and 2 ongoing research projects. We are facing some challenges. At the beginning, we had to build a structure. We have to make this 4 institutions to work as a single program, these 4 hospitals. Also, there's 10 dermatologists to think alike and understand the process that we're getting into. Only one of them had been a faculty of a prior residency program, so all of them were new in this journey. We had to adapt so residents could attend 2 5 weekly lectures, 1 weekly management conference, and they had to travel through the city to get all sat down in one single location. The most crucial part was building a philosophy. It was important to establish that dermatology was not aesthetics, that it was part of the curriculum, but the main part was medicine, and we were focusing on treating patients. We've been developing a work ethic, and we've been teaching the residents to always go the extra mile. The patient is their responsibility, and they're on charge of them. We had a very interesting situation, and actually that I faced when I came back, which was changing the academic curriculum. Dermatology was taught by subjects before. That meant that residents will see different dermatosis, different diseases, depending on the year of residency that we're into, and they were not read about them or learn about them again through the whole residency. So I adapted what I learned during my residency program and teach them to see every single disease through an entire year and repeat it year after year. So repetition can build the foundations for all the knowledge that they have to acquire. We've had some issues with interpersonal relationship and mental health problems between residents and nurse staff, also between the residents, and we had 2 residents with suicidal ideations that we were able to identify in time and get them the proper help that they needed. What is in the future for our program? We are trying to open a dermatopathology lab, a microscopy room, a major procedure room, and a Mohs surgery room. And also, we are looking forward to launch our own digital virtual slide library, thanks to the GLODERM Survey Access Grant that we got in 2024 to buy a slide scanner that we've been using to upload all our teaching cases for the residents because we can't afford a multi-head scope and we don't have the physical room. So they will be able to log in into a web platform, look at the cases on their own time at their house, and study through the chapters as they can learn, so they can learn dermatopathology in a better way. Also, we're looking into formalized international collaborations, exchange rotation for the residents, formalized national missions, and as long-term goals, provide highly trained dermatologists to the country, promote subspecialists and future leaders in specific fields in dermatology that we currently don't have, promote research, and at the end of the day, also try to provide care in underserved areas and public hospitals around the country. This is a picture of our residents and part of our staff during our Christmas party. And with that, I would like to thank you for your time and attention.